Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Damage control surgery. So this damage control surgery is divided into 5 stages. So the first stage will include the patient selection. So how you select the patient. And the second, it includes the control of the hemorrhage and the control of the contamination. So you control what? You control the hemorrhage as well as the contamination. Next, third one is there is resuscitation continued in the ICU. There is resuscitation which is continued in the ICU. Then the fourth one will include the definitive surgery. So definitive surgery. The fifth one, it will be the abdominal closure. So first let's look at the indications of the damage control surgery. So what are the indications of the damage control surgery? The indications, it includes, the first is the anatomical. So anatomical is an indication. So it means that it is inability to achieve the homeostasis, the hemostasis. The second one will be the complex abdominal injury. So in terms of the complex abdominal injury, so example will include the liver as well as the pancreas. Next will be the combined vascular. It is a combined vascular. There is solid as well as the hollow organs injury. So solid organ injury. So what does it include? It includes nothing but the aortal as well as the caval injury. Aortal as well as the caval injury. Then there is also the inaccessible major venous discharge, venous injury. So this includes the retrohepatic vena cava. So it's the retrohepatic vena cava. Then there is also the demand for the non-operative control. There is demand for the non-operative. So there is demand for the non-operative control, and this is of other injuries. So example will be the fracture of the pelvis. Then comes the anticipated need for the time-consuming procedures. So anticipated need, this is for the time-consuming procedures. Then we move on to the physiological. So what happens in terms of the physiological? So in physiological, there is a decline in the physiological reserve. So there is decline in the physiological reserve. So here, if you see the temperature will be less than 34 degrees Celsius. And what about the pH? The pH will also be less than 7.2. The serum lactate, this is going to be greater than 5 millimole per liter. And the normal reading here is nothing but it is less than 2.5 millimole per liter. Then when you look at the prothrombin time, this is known as the PT. So here it is greater than 16. And then looking at the PTT. So what is PTT? So PTT is nothing but partial thromboplastin time. This is greater than 60 seconds. Now the blood transfusion approaching. So blood transfusion approaching. So this is about 15 units. And when you look at the systolic BP, SBP, this is going to be less than 90 mm Hg, and this is greater than 60 minutes. Now when you look at the environmental, the operating time will be greater than 60 minutes, and it is nothing but the inability. There is inability to approximate the abdominal incision. So inability to approximate the abdominal incision. Abdominal incision. Then there is a desire to reassess the intra-abdominal contents. So desire to reassess the intra-abdominal contents. So they are directed relook. It is nothing but the directed relook. To learn and grow daily like this, please do subscribe.